16 million. Actually, how it started, Dr. APJ Abdul Kalam, the former President of India, during his inaugural address to the African Parliament in Johannesburg on 16 September 2004, proposed to connect all 53 AU member countries with Indian institutions with a satellite and fiber optic network to share India's expertise in the field of education and healthcare for accelerated social economic development of Africa. And then AU accepted this Indian proposal, and then umbrella MOU was signed between Government of India and AU. And Government of India appointed TCL as a turnkey implementing agency for this project. The network primarily provides e-services with priority on tele-education, telemedicine, and VVIP connectivity. VVIP connectivity is basically video conferencing and VVIP among the heads of African states. So basically, this is the way how they are connected. India, a subcontinent, is connected to Africa using a submarine cable. And then a typical diagram which shows that there is an MPLS network within India wherein all the institutions, that is universities and hospitals of India, are getting connected to a data center in Delhi, in TCIL. And then TCL is further getting connected to Dakar on IPLC. And we have a hub there, satellite hub, where we are connecting all the African countries' centers, that is 5 regional super specialty hospitals, 5 regional universities, 54 learning centers, 54 patient and locations, and 54 VVIP nodes in Africa through VSAT. And the services on Pan-Africa e-network are basically tele-education, Indian universities, African universities, then telemedicine consultations, Indian super specialty hospitals, then African regional hospitals, then continuing medical education from India as well as from African super specialty hospitals, then special lectures by eminent personalities, by, for example, recently Dr. Kalam and Mr. Pitoda had given lecture to all the African countries. Then VVIP communication, the equipments which are installed in patient and location hospitals in all the African countries. They are diagnostic equipments as well as pathological equipments. Then there are different stakeholders, collaborators, beneficiaries of the projects like Ministry of External Affairs, African Union Commission, and so and so. Then major benefits intended to African countries are capacity building by way of imparting education, 10,000 African students over 5 years period, then online medical consultation for 1 hour every day to each country for 5 years, offline advice for 5 patients per day to each country for 5 years, then CME for practicing doctors and working nurses. And these are the 48 countries that are connected on this network. Then these are the timelines when it was done, and these are the basically programs which are telemedical medical disciplines which are offered here, 18 medical and then there are some of the feedbacks from some of the African countries, and they want to further extend this project into their rural areas. So similarly, the other countries also, this network is also extended to other countries also. For example, in SAARC countries, Nepal, Afghanistan, and Bhutan, this tele-education is already implemented. And then we have ASEAN e-network, which is, because after seeing the success of this Pan-African e-network, Government of India, ME, has decided to get it extended to other countries also. For example, ASEAN e-network, then Pacific Islands, and then Eurasia network. So all those networks are also coming up, and SAARC network is already implemented, and it is functional in SAARC countries, 3 SAARC countries. So this network is primarily intended to provide telemedicine and CME services to remote locations in SAARC countries. And from India sides, 2 hospitals, PGI MER Chandigarh and SGPGI MS Lucknow, are offering these telemedicine, tele-education services. Then TCL's role is to design this network, and the architecture is like, VSAT network. I will just show you the diagram. This is the VSAT network. Two different hospitals in India are getting through MPLS cloud connected to VSAT hub at Bangalore, and then if it's further, these hub is, the VSATs are provided in these countries, so those countries are getting the, whatever the transmission is being sent from these hospitals. So, there's some style, but I think time is over. So basically, these are the new initiatives. That's all I have. Thank you.
So we only have 5 minutes for question and answers. Does anyone in the audience have a question or two to our distinguished panel here? About 5 minutes, which gives us about 2, maybe 3 questions max.
Thank you. TCIL, or Government of India, from implementing that system all over India?
Going on with Government of India, and couple of projects are being pushed, and most likely we are expecting that in near future those projects will be taking off. And one of the Indian projects, TCL is also part of that project of Ministry of Health, as I have mentioned, that is OncoNet. So other projects are also expected in near future.
When you say near future, when can we expect that?
It's very difficult to say, give this answer, because, the Government of India, takes time. But we expect that 1 or 2 projects may be coming up in this financial year.
Wow. I look forward to seeing them. Thank you once again.
Thank you. Any other questions? Maybe a comment as the questions are being general on. As you heard each other's comments, any ideas of innovating and collaborating together? Pass the microphone. And you've ended up with it. It's on.
I think it is possible. If you don't collaborate, you don't innovate. So the major challenge is it comes down to funding, and the problem I find, even to work across UK, India, when you have 9 institutions, when you go for gold standard institutions like All India Institute of Medicine, and then to have the IITs, that itself is a major barrier. But there are opportunities for collaborations. If you don't collaborate, you won't innovate. But I think the industries need to work more closer with the healthcare providers and the academia in the future. That's just my comment that I would like to say.
Wonderful. Well, to close this session, there's a verse of the Bible that the group was talking about before we all came in. It's in Luke 12, verse 48. Often misquoted and mistranslated. To whom is given much, much is expected. Actual translation is to whom is given much, much is required. As the panelists began their comments, they all had one common theme: the requirements to collaborate, to cooperate, and to...
Thank you so much, everyone, for sharing your insights with us. Thank you. Ladies and gentlemen, this brings us to the 5th and the last session for this evening, the session of Technology in Action, the chairpersons for which are Mr. Prem Kumar S. and Mr. Adi Kodeti. I'd like to give a brief description, a brief introduction about Mr. Prem Kumar and invite him on stage. Mr. Prem Kumar, as the Group CEO of India's premier pioneering hospital group, the Apollo Group, obviously, he's actively involved in bridging the gap provision of quality healthcare in India. The global standard of clinical excellence that defines Apollo Group's DNA, coupled with the expertise built in almost 3 decades, is at the core of his agenda. Prior to joining Apollo, he was Senior Corporate Officer and Global President for HCL Technologies, leading financial services, healthcare verticals, along with strategic leadership of customer proposition innovation, alliances and partnership, as well as global expansion. He was one of the key business leaders for the US $6 billion HCL Group, with whom he has been associated for over 28 years in various capacities. He was instrumental in ushering the various eras in the IT industry and helped in the internal transformation and global reach of HCL, including significant expansion in the United States and Europe. He brings a good exposure to the healthcare industry, hospital information systems, new trends in telemedicine, greater healthcare inclusion initiatives, as well as health insurance. He has been actively involved with the World Economic Forum at Davos and is part of the Global Council on Talent, Mobility and Diversity. The healthcare industry is an interesting inflection point in terms of opportunity, challenges and transformation, and thus ushering in this change and addressing this growth excites him immensely. Ladies and gentlemen, please help me welcome Mr. S. Prem Kumar. So I invite you on stage and ask you to please introduce all our other speakers and our co-chairperson for this evening as they come on stage in that order. Thank you so much.
Thank you very much. Thank you very much for the patience. It's been a long day, and I'm sure a lot of very quality information being shared. As they say, the cliche, the best is always reserved for the last, and here am I, standing in front of you before a great dinner that you have with us. We have a very interesting panel, and I think when I say it's the best is towards the end, it is because of the multi-dimensional perspective of the panel that I have today with me. Supporting me as co-chair is Adi Korati. I invite him to come over. Adi brings, as he comes and takes a seat, Adi brings with him as the Vice President of United Healthcare, leading what one would call